Greetings, psychology students. Professor Zeeb here, and welcome to another lecture in psychology and developmental psychology. This time we're going to talk about something that a lot of people probably don't want to talk about, and that is infertility. Even though it's sort of a touchy, sensitive subject, it's important to kind of discuss and put the message out there so we can help couples to get counseling and help them to get assistance in meeting their pregnancy needs and things like that, because obviously raising a family is a huge goal of a lot of people. So if we can get the message out there that a lot of these problems are treatable and so forth, it's very beneficial to do so. All right, so let's go to our slides here and let's talk about infertility. Okay, so let's first of all sort of discuss what infertile means. So a lot of people have a different viewpoint on what this is. So technically, the way we look at infertility, the way we define that, is where it's a couple who are actively trying to have a child for a full year. So 1 year has passed and they have had no success, unfortunately. So use your imagination what that means. They're actively trying, they're not using birth control, they're trying to get pregnant, but simply cannot have any success after a year has passed. So technically we would say that's infertility. Research basically shows that a lot of couples in our country struggle with this. So I've seen reports of anywhere from about 10 to 15% of all couples in the United States possibly meet the criteria for that definition. So the point is that a lot of couples struggle with this problem, unfortunately. And it turns out there are many, many different causes of infertility, and we're going to go over some of the key players here. All right, so let's take a look at that here. So different causes of infertility. So once again, we're just going to list some here. Number one, it simply could be the quality of the sperm. So maybe there's an issue with the sperm itself. And once again, there could be different scenarios in play here. But it could be that they're abnormally shaped. So you can see here on the left, this is what we would expect our typical sperm cell to look like. And then we can see across the board here some different abnormal forms. So sometimes they're too small, they're too big. Maybe they have two heads, if you will, or two tails. So typically the problem here is that they don't have what we call motility, which basically means they can't swim to get the job done, if you follow what I mean. So there's some kind of issue with the motility of the sperm in meeting the egg at the appropriate place and time in order for conception to occur. So sometimes it's simply the shape of the sperm itself, and that could be caused by many different things, okay, depending on the case. But let's move on here. It could also be irregular ovulation. This is actually a pretty common problem for women who are infertile, is that their ovulation is a little bit irregular. It could also be an STD, STD meaning sexually transmitted disease. We know that some of those are connected with problems when it comes to conceiving children. The two key players that I've seen, I mean, there may be more out there, but the ones that seem to come up a lot are chlamydia and gonorrhea, those two specifically. And the reason that they're often related to this issue is they lead to something called pelvic inflammatory disease. And so a lot of times these sexually transmitted diseases are connected to problems conceiving children, unfortunately. Okay, delaying childbearing. So a lot of women in our society are opting to have children later. You can see why that is. Maybe they're trying to get their career settled. They're trying to be very conservative about how they approach parenting, which I think is probably a good choice. So there's various reasons why women would wait longer compared to history, where a lot of times women were getting pregnant very young. So now we're finding that women are waiting to have children and so forth, okay? The problem is that a lot of these risks associated with infertility go up after 30 and especially after 35. So in other words, it turns out that our body is really designed to have children young, and the longer we wait, it could create some problems. So research is really showing that 35 plus, there's a lot more chance that some of these issues could occur. Okay, the next one is endometriosis, which is kind of a fancy term. And so what that basically means is that the endometrial tissue is found in the incorrect place. In other words, these cells may plant in other areas of the woman's body. For example, the fallopian tube would be a classic example of that. And they tend to grow there and attach. And the problem with that is it causes bleeding and blockage. So a lot of times the cause of this may be uncertain. It may cause a backflow of menstrual fluid, for example, which displaces the cells. Sometimes that's connected to why it actually happens. But the problem is that it disrupts the whole process of the egg traveling down the fallopian tube to hopefully meet a sperm in conception and so forth. And so it creates some problems. So if you're more of a visual person, let's take a look at this next slide here. All right, so here we have the diagram of the female body. We see the fallopian tubes here on the sides and the uterus and so forth. So typically, we would find that the ovum will travel down the fallopian tube, okay, where conception typically happens. Not always, of course, but a lot of times it happens there. The problem is that if these cells, for whatever reason, attach and create blockage and bleeding here in the fallopian tube, the egg cannot get down appropriately, or it disrupts the process in some way. So we're finding that is often a common issue when it comes to fertility, is that it's disrupting the normal procedure of conception and creates problems. So as you can see, there are a lot of different things that can be related to infertility. By the way, recreational drug use, certain drugs also are connected to that. So we're finding there's a lot of things that can actually contribute to infertility, but the good news is that there are solutions for nearly all of them. So I'm going to allow you, we're not going to go through all of these in the lecture here. I'm going to allow you just to pause the video and take a look, but just the overall point here is to notice that a lot of them have solutions to them. So that's good news. A lot of people are seeking help with these to enable them to become pregnant and raise children and have a family, which is a great thing. So if you're interested, pause the video, take a look at those, but this is going to wrap up the lecture. So hopefully we've gotten the message out that infertility can be a problem, but the good news is, once again, is that there's a lot of solutions to it. All right, so I hope you're enjoying the class, guys. Please move on to the next step in the class, and I will see you online.